you. A wave to the crowd, Mr. Maluki. Then we have Prof. Matilu Mwao. He is a medical doctor and infectious disease specialist who does research at the Kenya Medical Research Institute. He's currently the Deputy Director of KEMRI and the Director of the Center for Infectious and Parasitic Diseases Research at KEMRI. Prof. Mao will contribute a deep technical expertise and knowledge towards innovation and development of malaria control interventions. A wave to the crowd. Asante, Prof. Then we have Dr. Jacinta Wasike. Dr. Jacinta Wasike is a Deputy Chief Pharmacist at the Pharmacy and Poisons Board. Jacinta has extensive experience with regulatory requirements for registration of pharmaceutical supplies in Kenya. She's an active advocate for the local manufacturing of pharmaceutical products in Kenya and works closely with the private sector. She will play a crucial role in helping our local manufacturing industry meet the required international standards of good manufacturing practices. Again, we salute her in absentia. Then we have Ms. Joyce Momanyi. Joyce Momanyi is here representing the Council of Governors, and she's the current head of the COVID-19 Secretariat. And as we continue to devolve in the health sector, particularly with county engagement, Mrs. Momanyi will be critical in ensuring that we have subnational and community leaders who assist us with issues of health and advocacy when it comes to fighting malaria. A wave for the crowd, Momanyi. Thank you. And then we have Mr. Ronik Vora. The young gentleman there is a young graduate in business administration and works in sales and marketing and research development, director at Revital Healthcare EPZ Mombasa. He has been involved in the local manufacturing of PPEs, face masks, and rapid test kits. And he will also be the voice of the youth in the council. A wave to the crowd. Thank you. And then last but not least, we have Dr. Willis Akole, who we all know. He's the secretary. He's a medical doctor, a malaria specialist with extensive experience in public health management. Currently, Dr. Akwale is a senior advisor at the Africa Leaders Malaria Alliance, supporting His Excellency the President Uhuru Kenyatta's work as the chair of ALMA. Much of his career has been spent working on malaria prevention and control in Kenya and in the African continent. He has held several positions within the Kenyan Ministry of Health and in international organizations, and he brings to the Council experience working with global partners. He will serve as secretary and will oversee the day-to-day operations of the End Malaria Council Secretariat. Dr. Akwale, a wave to the crowd. Thank you. Thank you. And so that is our End Malaria Council. We thank you so much for accepting kuitikia huu mwito, and we welcome you to work with us. I think at this juncture, I'd like to then hand back over to you, Dr. Akwale.
Thank you very much, Madam Kaz. Thank you for unveiling and really reading the bios. You can see the wide range of expertise. I can assure you this selection was not easy. I can assure you. Even as late as last evening, I got a lot of texts. Daktari, can you consider me for that council? And I can tell you for almost 2 months, the names kept changing until we got this mix. So it hasn't been easy. Now I'll ask the council members to pick a pledge form which is on your table. All the council members, there is a pledge form. We want to see you committing to ensure that we fight malaria. As you've been told, the president has already committed. And our cabinet secretary, let's give him back his pledge. He committed long time ago, yes. Yeah, just in case he had forgotten. I'm sure he hadn't forgotten. I want us to all sign. And once we've signed, I want us to, once you've signed, council members will come and stand first in front. You are going to hold your pledge here, just in front of the cabinet secretary, and then we will, the cabinet secretary will walk up on the dais, and we'll follow him, and we'll do the official unveiling. So council members, once you sign, just come and stand here in front. We do a bit of photo, holding it just below your chest. Yes, let's start with the chair. The chair is there. It's already accepted the charge. Please come. Yes, Professor Mwangangi, please, just join. Eva? First, the first photo is just standing for the new members, those who are not signed. We have a photo of the Cabinet Secretary. He signed in Mombasa. It was a very hot afternoon, I remember. This way. Yeah. On this side. Let the red side be in front, eh? Yes. That way. Now, I will ask the Cabinet Secretary to come and we all sit, and then we are going to officially unveil. I'll also join the team. Yeah. So let's go up the podium, all of us, and the official unveiling. Another picture. Yes. Where is the chair? Chair, you need to. Yes, we need a chair. Is that? Yes. I am here. So, we are going to ask the Cabinet Secretary to officially inaugurate this committee. And as that happens, after he says he's going to read his speech here, he will just say, welcome and officially inaugurate us. I think we'll all applaud for the same. So, are we ready? Ready? Okay.
Well, I have been asked to say that I officially inaugurate this council and wish them all the very best. I know that it's going to be challenging because I'm not taking the speech, but I'm going back.
Thank you very much. Take your seats. Take your seats. Let me, at this juncture, now welcome the newly inaugurated chair of Kenya's End Malaria Council, so that you will hear his voice and he can affirm to us his acceptance. Mr. Christopher Getonga, welcome. Let's clap for him. He's taking on a very big responsibility. Welcome.
Thank you, Dr. Hakwale. Okay, Cabinet Secretary for Health, Senator Kagwe. The Chief Administrative Secretary, Mwangangi, all protocols observed. To begin with, I'd like to thank His Excellency President Uhuru Kenyatta for his leadership in the fight against malaria as the chair of the African Leaders Malaria Alliance, and for his call to action for African countries to establish an End Malaria Council and funds. I would also like to thank the Honorable Minister of Health, Senator Mutahi Kagwe, and the entire Ministry of Health and his partners for prioritizing the formation of this council. On behalf of myself and the fellow members of the End Malaria Council, I declare that zero malaria starts with us. We are ready, willing and able to meet the charge that we have been given. We dedicate ourselves as malaria champions and will work as partners to the National Malaria Program and the people of Kenya to end malaria. We begin our work as the End Malaria Council during an unprecedented and trying time. It is a time when all eyes are focused on health and health of the economy, and all are exhausted by the corona pandemic. We must, however, remain vigilant, especially given that malaria continues to afflict and kill many more people in this country, especially children and pregnant women. As a founding chairman of this council, I'm fully cognizant of the enormous responsibilities bestowed to me and my council. I understand that the mandate of ensuring that malaria remains high on the development agenda and to take action to ensure the implementation of Kenya's malaria strategy is not going to be easy. However, with innovation and collaboration for stakeholders, including the communities at risk, we shall prevail. So we call on all Kenyans to join us in our efforts as members of the End Malaria Council. We must do all our part. We must declare that zero malaria starts with me. One startling statistics which I just read this morning was that every 7 seconds a new malaria case is reported in Kenya. I promise to do all within my power to raise resources to support malaria control efforts in Kenya from all sectors of the economy. I will also provide the necessary leadership towards ensuring the local manufacture of malaria control commodities like bed nets, medicines, to ensure we sustain our efforts and contribute to the economy. There are very many industries in Kenya that can actually produce all of these items that we need. And I think it's Buy Kenya, Build Kenya is one of the mottos of our president. In the coming weeks, we will be announcing a series of initiatives across all sectors to support the fight against malaria. If you'd like more information about the End Malaria Council and want to donate or get involved in the fight against malaria, please go to endmalaria.ke. I would also like to mention Dr. Willis Akwale, the Secretary to the Board, and just to say that we were just put together a couple of weeks ago, and he has been very, very instrumental in keeping us informed of what is coming and educating us on what we need to do. Thank you, Doc. I'd also like to thank Dr. Ganatra and Dr. Kizuku for the information that you gave us on the slides. Very, very important information. Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with us. Thank you.
Yeah, ladies and gentlemen, you have a chairman now. You have a council and now you have a chairman. Every reason. He has already told you he's going to raise resources. For many years when I've been in the malaria world, people keep saying, we should diversify our resources. We should get local resources. Today is the day we begin that journey. And the chair has committed to that. Thank you very much, Mr. Chris Kitonga. So, ladies and gentlemen, I will now invite our Chief Administrative Secretary so that she can invite the Cabinet Secretary to give his speech for this day. Welcome, Madam.
Thank you. Thank you, Dr. Akwale. I'm just as excited as you are because really this is the beginning of a journey for us, particularly on local manufacturing. The potential is immense within the country. And so at this juncture, I'd like to invite the Cabinet Secretary, Senator Mutahi Kagwe, to come and give his keynote address today as we inaugurate members of the End Malaria Council. Karibu Waziri. I think they're cheering for you.
Thank you very much, Mercy. Distinguished ladies and gentlemen, and I can see a huge presence of my friends, members of the Fourth Estate. Good morning, And thank you for attending this important event to inaugurate Kenya's first ever End Malaria Council. Last year, upon taking over the chairmanship of the Africa Leaders Malaria Alliance, His Excellency President Uhuru Kenyatta called for the establishment of country-led malaria councils and funds as part of his legacy agenda towards the elimination of malaria on the African continent. Today, we fulfill His Excellency's call to action with the unveiling of Kenya's End Malaria Council. This council is the fifth to be launched in the African continent after Eswatini, Uganda, Zambia, and Mozambique. It will play a very critical role in mobilizing local resources to drive the agenda of malaria control and elimination in Kenya in a much more sustainable way. According to the World Health Organization's World Malaria Report 2020, and I recognize and appreciate the presence of the local representative, Rudy Eggers, there were 215 million malaria cases and 384,000 malaria deaths in Africa in 2019. It concerns us, therefore, that malaria incident rates in Africa has plateaued since 2015, when it was expected to be on a downward trend. Consequently, Africa is not on track to achieve its 2020 target of reducing malaria incidence and mortality by 40% and the goal of eliminating malaria by 2030. Whilst it's true, for the national average, the burden of malaria is not spread evenly across our great country. The greatest burden, as was ably demonstrated here in the presentation, is in Busia and Siaya, where incidence is more than 6 times higher than the national average. Many factors account for this, but perhaps none so much more than the presence of extensive number of breeding sites near homesteads. To mitigate against this, we plan to accelerate efforts that will include application of measures to spray and kill mosquito larvae at the source in these counties during the second quarter of this calendar year. And to ensure that those two and other counties also address other aspects aimed at fighting malaria, His Excellency the President recently launched the use of malaria scorecard, which will aid health workers and community members in identifying factors that could be responsible for increased numbers of cases. Once these are identified, it will be easy then to develop effective and targeted preventive measures. The year 2020, as everybody knows, was a terrible year we could wish to forget. The COVID-19 pandemic has changed our lives in an unprecedented manner. The pandemic provided another challenge in the noble fight against malaria. At the onset of the pandemic, the World Health Organization predicted a doubling of malaria deaths if severe disruptions to insecticide-treated net campaigns and access to anti-malarial medicines were experienced. Although Kenya continues to experience public health and socio-economic impact as a result of COVID-19 pandemic, I'm delighted to say that through commendable efforts by the government and its development partners, this predicted doubling in malaria deaths was averted. We ensured the continued distribution of insecticide-treated bed nets The availability of medicines at our health facilities and indoor residue spraying took place as planned, whilst COVID-19 protocols were being observed. As noble and esteemed leaders have remarked, the true measure, and I quote, the true measure of any society can be found in how it treats its most vulnerable members, end of quote. By ensuring that all Kenyans, and especially children and pregnant women, have access to life-saving medicines, insecticide-treated mosquito nets, and other commodities, we took and indeed continue to take steps forward. One of the key bottlenecks we have encountered during the COVID-19 pandemic has been the difficulty in securing essential health commodities, including malaria diagnostics, treatments, and vector control tools in a timely manner, especially when these have been manufactured outside our country. We must work together to ensure that those commodities are manufactured locally here in Kenya. By promoting local manufacturing, we shall reduce reliance on foreign manufactured malaria supplies, ensure economic development, as well as easy access and timely delivery of these essential commodities to the populations at risk of malaria. Let me make a special appeal here, particularly to our development partners and those who contribute with us. You saw the percentage of contribution that comes from our donor community. But I want to make a special appeal that they lay emphasis as well on local manufactured products and local manufactured pharmaceutical products. And I'll tell you why I'm making this special appeal. Is because on several occasions when we ask why is it that we cannot buy locally manufactured materials, we know, for example, that there are organizations that have been exporting outside of Kenya to other countries, and yet we in Kenya are not buying from them, and these are Kenyan organizations. It just doesn't make sense. But we are told that some of these situations is because of the donor condition, conditions where you have got to go for a global tender, even when these things are being manufactured here in our country. And I want to make a special appeal to our funding partners that whenever we have got these products locally, please let us buy from our local manufacturers. And two things happen immediately. One of them is that we are able to move these commodities quickly, and secondly, we provide jobs. We give jobs to our people. Whenever you order 1 million, 2 million nets to be manufactured outside Kenya and brought into Kenya, you have just exported some 5,000 jobs. And if there is one thing I know we need in this country, is jobs. The other thing we are told is that the process by which the World Health Organization, and I'm happy that Rudy, you're here, that the process by which the World Health Organization gives approvals, because the funding agencies tell us we can't buy because the World Health Organization has not recommended that product. And the process by which the World Health Organization takes in order for them to approve a commodity apparently is so rigorous that some of our people are unable to meet those standards. And we don't want to compromise, of course, we don't want to compromise on the kind of quality of product that we have. But we have learned through the PPEs that we are making in our country today, we have learned that these things are possible. And therefore, I would like to request also the World Health Organization to look at the issue of fast-tracking, where local manufacturers can be assisted and where local manufacturers can be given priority. Because what we saw this year, and we have continued to see it, is that unless we are locally, unless we rely on ourselves locally, we will continue to be challenged. Take the current issue of vaccines.
It is not that we don't have the money to buy vaccines, but the vaccines are still not available to us. Why? Because obviously the country is making those vaccines. We'll give priority to those, they'll give priority to national interests before they ever come to us. So it's absolutely critical. And I want to challenge the Council, I want to challenge the donor community, I want to challenge the World Health Organization that we give priority for the local manufacturing aspect. And as a government and as a cabinet, we have pronounced ourselves on this matter, that at least the Kenya part of the funding will definitely go to local manufacturers. We also want to appeal to the local manufacturers to up their game in terms of quality, to ensure that the quality that we have of products in our nation are absolutely at best practice globally. So COVID-19 is also a stark reminder of the impact of disease on our socio-economic development. This is also true of malaria. Past studies have demonstrated that malaria reduces economic growth by up to 1.3% each year, and estimates suggest that workers miss nearly 12 million days of work each year in Kenya because of malaria. This is equivalent to removing the productivity of some 50,000 workers from our economy. Similarly, malaria reduces academic achievement and causes children to miss upwards of 3% of their schooling. A healthy economy requires healthy and educated workers, especially as we look forward to the recovery following the ongoing pandemic. To succeed in our mission to end malaria, we must address financial resource gaps that have been demonstrated here by the able presenters. And what Githuka said about the resource gap of 24 billion to fully implement our current malaria strategic plan, which covers between 2019 and 2023, is indeed a challenge. We must close this gap to ensure that we have the required malaria supplies to not only treat malaria, but effectively prevent it in the first place. And I want to emphasize that the issue of prevention. And it is not just malaria. As a ministry, the philosophy and policy that we have adopted is one of prevention, prevention, prevention. Primary health care, our public health effort is going to be intensified at the prevention level. Therefore, if you looked at the gap that was here, for example, the issue of intervention, spraying, and what have you, there was a huge gap of financing and funding. Yet, that is our top priority. We had rather prevent disease than cure disease. There's been too much emphasis on the curative aspects as opposed to the prevention aspects. And what we have seen is with hygiene measures, even during the COVID-19 period, it is possible to reduce the disease burden by working more at prevention than at curing. So we must expand our outreach in affected communities to ensure that everyone has the knowledge to protect themselves and their families against malaria. My hope is that this Council will prioritize working and supporting community-led initiatives. This Council, as you have seen for yourselves, is a public-private community partnership. Its members, as introduced, are senior leaders drawn from government, the private sector, civil society, and research institutions. Each and every one of you has unique experience and capabilities that will contribute significantly to the fight against malaria. This Council is not a replacement of the National Malaria Program, which will remain primarily responsible for the technical implementation of the National Malaria Strategy. Instead, the Council will advocate for malaria to remain high on the strategic agenda across all sectors of the government, the private sector, civil society, and sensitize all leaders to the importance of ending malaria. This Council will drive action by the various sectors to support the implementation of Kenya's malaria strategy. This Council will establish and manage a fund and can receive, manage and disburse financial and in-kind donations from various sectors to close the budget gap under the Kenya Malaria Strategy. You'll also establish and implement transparent process to receive contributions, invest available resources, and receive funding requests from the counties and malaria programs. You prioritize actions towards promoting and strengthening the local manufacture of malaria control commodities and supplies, and identify priority activities for funding. This Council will use their unique experience and capabilities to drive innovation and make malaria elimination more efficient, sustainable, and achievable. And finally, this Council will promote mutual accountability between the sectors for the successful implementation of the National Malaria Strategic Plan and elimination of malaria by 2030. To support these efforts, my ministry, through the National Malaria Program, will provide quarterly updates to the Council members on the status of malaria control and elimination and the gaps and bottlenecks that the country faces. We will also share the national and subnational malaria scorecards and work plans to ensure that the End Malaria Council work in a focused and evidence-based approach. Council members, it's so important that we eradicate malaria completely. And why so? Because by doing so, the many deaths occasioned by malaria will be avoided, and more people will become more productive in the growth of our country's economy. Further, eradication of malaria will free the capacity of our health workers to address health conditions that cannot be avoided, and also strengthen the resilience of our health system. It is therefore with great pleasure and privilege that I now inaugurate Kenya's End Malaria Council and charge its founding members to do the country proud by laying a strong foundation towards the elimination of malaria in Kenya. Zero malaria starts with me and with all of us.